7 heart failure warning signs seniors ignore every single day. And ignoring just 3 can significantly raise your risk of complications. Studies show that untreated heart symptoms worsen outcomes rapidly, especially with every day of delay. A 72-year-old man started with one tiny clue. He'd lie down at night, close his eyes, and suddenly sit back up gasping, as if someone had stolen all the oxygen from the room. He blamed his pillow. Then clue number 2, tying his shoes made him short of breath. Bend, breathe, tight chest. He waved it off. I'm just out of shape. By clue 3, his socks left deep lines by evening. The scale crept up 3 pounds in 5 days, even though he wasn't eating more. None of this felt like an emergency, but together these nothing moments were spelling out a message most seniors miss until it's too late. Your heart is failing, and it's asking for help the only way it knows how. In the next 13 minutes, we're decoding all 7 signals, including the bizarre shoe-tying test that predicts heart trouble with surprising accuracy, and the 2-minute morning check that could save your life before breakfast. And to understand why your body hides these warnings in plain sight, we have to start where oxygen meets gravity at night. Here's something most people don't realize. Colds and allergies usually feel better when you lie down. Heart trouble often does the opposite. If breathing gets harder the moment you're flat, so you stack pillows or even sleep upright, your heart is sending its first quiet distress signal. Doctors call this orthopnea, and it often appears months, even years, before a serious event. Here's what's happening. During the day, gravity pulls fluid toward your legs. At night, that fluid returns to your bloodstream. If your heart can't handle the extra volume, pressure builds toward your lungs. That's why you suddenly can't breathe lying down. People often brush it off as just getting older. But here's the test. If sitting up makes the breathlessness fade within a few minutes, note it down because the pattern matters. And if you wake up 1 to 2 hours after sleeping, gasping for air until you sit or stand, that's an even louder warning. Quick question. How many pillows do you sleep with? Drop a number in the comments. It helps others see what's typical and what's not. Nights tell the lung story, but mornings reveal the next clue. In your socks, your rings, and a single number on your bathroom scale. While you wait for the kettle to boil, try this. Press your thumb just above your shin bone for 3 seconds. Lift it. If the dent stays like memory foam, that's pitting edema. Fluid your heart isn't moving efficiently. Shoes that tighten by evening. Rings that get snug halfway. They're not random. They're early warnings. Heart experts note that swelling in the ankles or legs is often among the first signs noticed in developing heart failure. Yet most people dismiss it as just from standing too long. Fewer than 1 in 5 report it promptly to their doctor. The most important clue, rapid weight change without a reason. If you gain 2 to 3 pounds in a few days with no change in diet, that's not fat, it's fluid. That's why cardiology teams tell patients to weigh themselves every morning and call if they rise 4 to 5 pounds in a week. Starting tomorrow, same scale, same time, after the bathroom, before breakfast. Write it down. 1 number, 1 line. That small habit can fast-forward your doctor's ability to act early. Sometimes edema starts higher up, in the belly, tightening waistbands or making you feel full faster. But there's an even stranger clue that appears while getting dressed. One so specific researchers gave it a name. The shoe-tying test sounds almost ridiculous, but it's one of the most precise warnings science has discovered. Try this right now. Sit, bend forward as if tying your shoes. Stay bent for 30 seconds. Notice your breathing. If you get short of breath, and it eases when you straighten, that's bendopnea. Researchers found that in people with early heart failure, bending briefly increases chest pressure, making breathing harder. It's not random. It's mechanical. Bendopnea alone doesn't mean disease. Extra belly pressure, lung issues, or fitness level can all play a part. But if it shows up alongside ankle swelling or nighttime gasping, that's a pattern to take seriously. Think of it like a dashboard light. One light? Maybe fine. 3 lights at once? Pull over and check. Try the bendopnea test right now and comment below. Easy, slightly winded, or had to sit back up. Your answer might help someone else connect their own dots. The heart doesn't only speak through breath and fluid. Sometimes it talks through energy, how quickly your batteries drain. Remember the 72-year-old from the start, stacking pillows at night? Here's what happened next. He stopped walking to the mailbox, not because he couldn't, but because by the time he thought about it, he was too tired to try. That's how fatigue disguises itself in early heart failure. If normal tasks suddenly feel like uphill climbs, that's exercise intolerance. One of the top warning signs. Your muscles get less oxygen-rich blood, so they tire faster. You rest more. You blame just aging. Research from the American Heart Association highlights that fatigue is one of the most common early symptoms, but only about a third of patients realize it's coming from their heart. The brain also feels it. Seniors often show subtle evening confusion or brain fog because small dips in circulation affect focus and memory first. Try tracking distances. How far can you walk without stopping this week versus last month? Can you talk comfortably while walking, or do you need to pause for air? That talk test is an easy home gauge of progress, but fatigue isn't the only energy clue. There's a nighttime pattern that wakes people up gasping, and emergency doctors take it very seriously. Imagine this. You fall asleep fine. Then 1 to 2 hours later, you jolt awake, gasping, heart pounding, like you're drowning in air. You sit up, and within minutes, it passes. You blame stress, maybe a dream, but if it happens repeatedly, always at the same time, it's a red flag. When you lie down, fluid that settled in your legs returns to your chest. If your heart can't pump fast enough, it backs into the lungs, causing that sudden suffocation feeling. This isn't sleep apnea, it's fluid redistribution, and doctors list it among the clearest early signs of heart failure. If it happens to you, write down the time, duration, and whether sitting up helped. Those 3 notes can help your doctor spot patterns faster than any guesswork. And sometimes your lungs make noise to tell the same story, even when nothing's stuck in them. A dry, tickly cough that worsens when lying down can mean your lungs are irritated by fluid buildup. Not mucus, not infection. When the heart lags, pressure builds in the lungs' tiny blood vessels. A bit of fluid leaks into tissue, and your airway tries to clear what isn't there. It's easy to blame allergies or reflux. But if your cough pairs with swelling, breathlessness, or fatigue, it's not just a cough anymore. It's part of the same chain reaction. Have you had a dry cough for more than 3 weeks that gets worse at night? Comment yes or no. Your answer might help someone realize they're not alone. And the final sign hides where no one expects it, in your appetite and waistline. If you've lost your appetite, food just doesn't sound good, or you feel full after a few bites, your heart may be the reason. When the right side of the heart weakens, blood backs up into the liver and gut, causing abdominal fluid buildup, ascites. This leads to bloating and that constant tight belt feeling. Studies indicate this happens to many people with heart failure, sometimes leading to reduced appetite or gradual weight loss in later stages. Most mistake it for digestive issues. If your waistband is tightening but your arms and legs seem thinner, it could be fluid in the belly, not fat. That's a key sign to note. Knowing the 7 signs is half the story. The next part is what to do about them. safely and without panic. Step 1. Start a one-page symptom log tonight. Track daily for 1 week. Morning weight, same scale, same time. Pillows needed to sleep comfortably. Thumb press test result, none, mild or deep. Walking distance and talk test. Any nighttime gasping, what time, how long it lasted. 7 days of notes show a pattern no one can ignore. Step 2. Ask for 2 key tests if you spot 3 or more signs. The BNP or NT-proBNP blood test. It measures a hormone the heart releases when under stress, and an echocardiogram, a painless ultrasound that shows how well your heart pumps. Both are quick and non-invasive. Together, they separate guesswork from clarity. Remember, this video isn't medical advice. Use it as education, then talk with your doctor. Everyone's body and thresholds are different. Step 3. Know when it's an emergency. Call 999 or your local emergency number if you have. Sudden shortness of breath that doesn't ease when sitting up. Chest pressure, sweating, or nausea. Coughing pink, frothy fluid. Weight gain of 5+ pounds in 48 hours. Sudden confusion or exhaustion. Every 40 seconds, someone suffers a heart attack. Half had warnings first, they just didn't connect them. Let's close the story we began. The man who nearly waited too long. Remember the 72-year-old who blamed his pillow? After weeks of ignoring it, his wife noticed the patterns. The stacked pillows, the breathlessness bending down, the swelling socks. She wrote them down. At his checkup, she handed the doctor 1 page. That single page changed everything. Tests showed his heart pumping at 35% efficiency. Early but not irreversible. With treatment, less salt, and short daily walks, his numbers improved. He sleeps with 1 pillow now, walks his dog every morning, and tells everyone, "I thought I was just getting old." That's the difference between catching it early and catching it in the hospital. 7 small clues, none loud, all life-changing when combined. Lying flat shouldn't steal your breath. Bending to tie shoes shouldn't feel like a workout. Socks shouldn't leave deep lines by evening. When they do, it's not failure, it's communication. Your body's asking for attention, not panic. Start your 1-week log tonight. Spot the patterns, bring them to your doctor, ask for those 2 tests, and if the signs hit hard or fast, call right away. Because early heart failure is manageable. Late heart failure is life-altering. Your heart isn't giving up on you. Don't give up on it. Watch next. What happens after a heart failure diagnosis? It breaks down treatment, recovery, and daily habits that strengthen your heart after 60. Or, if you prefer prevention, check out 5 foods that strengthen your heart after 60. Both could save your life.